Hello, I'm Dr. Brandt Gibson, and tonight I want to talk to you about plantar fasciitis and the option of bracing or splinting or using orthotics for plantar fasciitis. So just a quick reminder, plantar fasciitis is an inflammation of the ligament on the bottom of the foot. So you have the heel, you have the Achilles tendon that attaches, you have the plantar fascia that attaches, the Achilles tendon is pulling in one direction, plantar fascia pulling the other. Plantar fascia, the weaker of the two, gets inflamed, painful, and tender. And it hurts first step in the morning, hurts when you get up after sitting down for a period of time, and it's pretty significant pain that you'll actually run into. So the idea is, are there things that you can do to brace it or splint it or so forth? Well, there are not any real good splints as far as something that will actually reduce the symptoms, reduce the pain, although there are a lot that are on the market that are being sold for it. Those wraps around the arch, for example, typically won't do anything unless you're getting a tendonitis 2, which they will treat and reduce some of that tendonitis, but they don't treat the plantar fasciitis. The best splinting for plantar fasciitis is a night splint or a Strasbourg sock, which have a similar mechanism. Basically, what they're doing is they're designed to hold the foot at 90 degrees while you sleep to allow the plantar fascia, as it's healing while you're sleeping, to not shorten as much. It keeps it lengthened, keeps it stretched out. And then as it heals, it actually can get back to normal length. Even when you step down, you're not re-tearing it because it's staying lengthened. Big disadvantage of night splints or Strasbourg socks is comfort. So a lot of times people will end up taking them off during the night because they're not comfortable. But they are effective. If you're able to wear them and able to use them, they can be very effective at helping stretch out that Achilles tendon and helping maintain a length of the plantar fascia to reduce the recurrence of plantar fasciitis, or at least reduce the symptoms or pain in the morning. The second thing that will commonly be done for this is arch supports or orthotics. Plantar fasciitis is caused by the way you walk. It's basically what's happening is you're stressing that plantar fascia because of the way you walk. And that can happen if you're supinating or rolling out on the foot, or pronating, rolling in on the foot. Either one can actually allow you to overwork that plantar fascia, cause plantar fasciitis, and keep it going just by the simple act of walking. So by going into an orthotic that puts you back into neutral position, you take the pressure off the Achilles tendon, take the pressure off the plantar fascia, and allow it to heal and recover. Best option is a custom orthotic that's designed exactly for your foot. But if you're going to do an orthotic, you also want to make sure that they've actually seen how you walk and are making adjustments to allow you to walk in the more ideal, which means you land on the outside of the heel and roll to the big toe. There are other types of inserts, arch supports, those kind of things, and some of them will work. If you're going to say, okay, I really want the best option, I would get a custom orthotic that's designed for you based on how you walk and based on the form and shape of your foot. This is Dr. Brandt Gibson, and this is your Podiatry Tips Day 225, bracing and orthotics for the treatment of plantar fasciitis. They can be very, very effective if they're done appropriately.